Okay, so I'm going to talk about reaching migrant farm workers to promote health and well-being. And for research, of course. This work was conducted as part of our Center for Agricultural Safety and Health and funded by the National Institute for Occupational Safety and Health, which lives in the Centers for Disease Control. I have no commercial interest to disclose. And these are our partners that you see logos of on the screen. Just to orient you to what an ag center is, NIOSH funds 12 of these. We're the 12th one, so we've been funded only for 2 years. The other centers have been around for decades. So we are still expanding, finding partners, and expanding our research portfolio as well. So today what I'll talk about are these four things. Who are migrant and seasonal farm workers in the US and globally? What are the challenges to farm worker health and well-being? And look at those acronyms. FW is farm workers, WB is well-being. What evidence suggests excess risk of cancer among farm workers? And how can we overcome challenges to conduct outreach? And in that segment, I'll talk about some of the projects that we're doing. So who are migrant and seasonal farm workers in the US and globally? Let me start with Illinois. So here's Illinois on the map. There are about 3 million farm workers in the United States. And according to the latest Census of Agriculture from 2022, there are 52,000 in Illinois. About 80% of farm workers work in crops and 20% in livestock. 26% are women. The mean age is the 40s. The majority are foreign-born and Spanish-speaking and come from south of the US border, mainly Mexico and also Central America, a few from South America. And then we have some from the Caribbean islands as well, but not so much in Illinois per se. Around 45% of farm workers in the US lack legal status, meaning that they're both in the country illegally and working in agriculture illegally. About 85% of farm workers that work seasonally in the US are settled actually in the US. 10% travel more than 75 miles for work, and only about 5% now follow the crop from south to north. It used to be much more over the last decades, but that's decreased a lot. And somewhere between 3 and 10% cross the border, the US border, back and forth to work here. There are also H-2A visa holders. That's a special program for agricultural workers, and they're brought to work in ag in the summer in Illinois. We have around 2,000 to 3,000 H-2A workers in the state. What about globally? So I took this graphic from the World Bank, and this shows the share of GDP from agriculture in 2022. There are about 1 billion workers in agriculture worldwide. 26.7% of the global labor force is in agriculture. There are around 2.4 million farm workers in the EU, and 43% of the workforce in Africa is agricultural workers. And this is kind of mixing and matching migrants and locals and farm owners and families and so on. Just to orient you a little further, the US GDP gets $203.5 billion, or 0.7% of our GDP, from farms, so from ag production. About 1.5 trillion, or almost 6%, come from the food supply chain overall. So what are the challenges to farm worker health and well-being? I think that farm workers, hired migrant and seasonal farm workers, are the quintessential underserved and disadvantaged worker population in the US and maybe globally. They have very short-term labor contracts. As you saw, a lot of them are working illegally, so they're often paid in cash. They make very low wages. They're allowed to receive lower wages than the prevailing minimum wage in agriculture. And because it's cash economy, their wages, of course, could be all over the place. They have no social benefits. They're not afforded insurance, paid sick leave, workers' compensation. They're not eligible in Illinois and in most states for any of that. They often don't know who their employer is because they work in a very tiered system where there might be a big agribusiness conglomerate that contracts with farm owners, that contracts with a temp staffing company, and then has crew leaders and supervisors. And so the farm worker who's doing the work in the field is probably relating to the next higher level and doesn't really know this big structure of employment surrounding them. Ag work is far from home. Of course, if they're migrant, then they're very far from home. Their work is remote, so it's hidden and it's hard to conduct oversight of this work to protect them. They live in all kinds of housing, generally poor housing, which is makeshift. They live in labor camps, sometimes tents, buses. They share their housing with a lot of people, often strangers. They also lack knowledge of their employment rights and their OSH rights. It's hard for me to understand exactly what all their employment rights are, so all the more so for them. And they're unlikely to exercise their rights, both because of their legal status, but also from being so remote and knowing where to go. Their work is very hazardous. So the agriculture sector in the United States, and I think worldwide, has a higher rate of fatalities and of non-fatal work-related injuries than any other sector of the economy. And there are a lot of upstream issues that impact farm workers that I think make it particularly difficult, but I feel like I have to mention these here. These workers have basically induced migration because of the national or local conditions in the countries where they're living that drive them north to make to earn a living wage. There are visa policies that we have in the US that are crafted to hire foreigners into jobs with wages and in job tasks that are unacceptable to US workers. I'm using the terminology neoliberalism, but and it's updated, upgraded, but just to say that there are free trade policies and aspects of the U.S. Farm Bill that unbalance trade and disadvantage the countries to the south of the United States, which induces labor migration due to poverty. I think we also have an ostrich approach in this realm, which is that despite the fact that we need these workers, everybody, employers, government, policy makers, and the public are in collusion to maintain the status quo and not really acknowledge that. And if you watched the US debate last night, you could see it there also that immigrants are the enemy, and we don't want to acknowledge their integral importance to our economy. There's also agricultural exceptionalism. In the US, the agriculture sector is exempt from employment legislation. Wages and hours can be different. Children are allowed to work down to the age of 12 legally. Again, they lack workers' compensation, paid sick leave, other social benefits. And then the OSH, Occupational Safety and Health Oversight, is fragmented across agencies. So OSHA doesn't have jurisdiction as usual in all agricultural workplaces. And then finally, the environmental protections in agriculture are different than they are for the rest of the country. In terms of occupational safety and health, agriculture is dangerous. And then finally, there's this is farm workers are sort of the poster child for intersectionality. They they are at the intersection of low wages, lack of benefits, poor housing and transportation, limited opportunities for education, and social stability. And that's piled on established social hierarchies, lives of poverty, physical violence, lack of rights, and dangerous border crossings. So this is, I hope you're convinced now that this is probably the most disadvantaged worker population in the US, if not in the world. In general, farm workers are critical to the food security chain. And just to point out this concept of food sovereignty, which is the right of people to healthy and culturally appropriate food that's produced through ecologically sound and sustainable methods, and the right to define their own food and agriculture systems rather than having agribusiness tell us what to eat. On the ground, we should be saying what is right to produce and what people should be eating. And then also there are a lot of violations of worker justice. 2 million workers are working in bonded labor in the world, more work under shady contracts. There are issues of migration, employment, and health that are different in different places, but I would say all challenged in their own way. Okay, so that's the backdrop that I wanted to present. And because you guys are IARC, I couldn't ignore talking about cancer risk, although I'm on thin ice. I'm not an expert in this area, but I'll just point out a few recent studies. There's the studies by Andreotti et al. Showing chronic pesticide exposure leading to renal cell cancer. And this is from the Agricultural Health Study, which is a prospective cohort of over 57,000 licensed pesticide applicators. And I have a list here of the pesticides that are associated with renal cell carcinoma. Gatto et al. Looked at farming and cancers and found an association with brain cancer. This is a meta-analysis of 52 studies, and livestock farming was higher than crop farming and had a much stronger association. There's the AGRICOH study with Togawa as the lead author that looks at exposure in utero and cohort studies from France, the US, Norway, Australia, Korea, Denmark. There's an increased risk of multiple myeloma in women, an increase in prostate cancer, and so far an apparent deficit of bladder, breast, colorectal, esophageal, laryngeal, lung, pancreas, and all cancers combined. The California Cancer Registry with birth certificates was published by Park in 2020. There's a higher risk of ALL, acute lymphocytic leukemia, with exposure to any carcinogenic pesticide. There's a glyphosate. There are glyphosate studies showing non-Hodgkin's lymphoma, and a higher concentration in urine showed biomarkers of oxidative stress. Sun exposure has been associated with skin cancer. Of course, that's a big problem for outdoor workers. And then lifestyle and limited screening, which are very common problems among farm workers, are associated with cancer. So that's as much as I'm going to say about cancer. I'm sure most people on this webinar could talk way more about this than I can. So the other health effects that I wanted to talk about were a higher incidence of heat stress, musculoskeletal pain, respiratory illness, injury and fatality. And so these are studied in a variety of ways, largely in large databases. So this comes from secondary data analyses of large databases in the US and around the world. There are also lifestyle issues for farm workers. because of their social stratum and so on, as I described. So there are substance abuse issues. People are far from home. They're living in man camps, so to speak. There are problems with diabetes, obesity, cigarette smoking, various alcohol, various substances, and sexually transmitted infections in these scenarios. And so, as you all know, there are associations with a variety of cancer types and other illnesses. Okay. So now I want to get to the heart of this, really. How can we overcome challenges to conduct outreach to farm workers? And that's really our main task in the NIOSH Ag Center here. So I'm going to talk about a few things here. I'm going to talk about finding farm workers in the field. I'm going to talk about training approaches that we're using. And then I'll talk about a mechanism for staying in contact with farm workers and also one particular study that we're doing. So when people apply for H-2A visas, owners or people on their behalf apply for these visas, then they apply for an X number of visas. They must have housing provided for them. It goes formally through the government. And so you can get a list of all the housing sites on the web from any state in the United States. So I'm showing you Illinois. And then there's creation of this map called a spotlight. And so here are the centers, kind of the centers where farm worker housing is located. In the center of these little dots, it has the number of farm workers for whom there are visas. So that's one way to find them. And just to say that there are a lot of entities in Illinois that are running around looking at H-2A workers. This type of housing, those workers have tremendous oversight. And so many entities are overlooking them and not so much all the other workers in the state, like all the other 50,000 workers in the state. We also have a partnership with two clinic systems, mainly with Community Health Partnership of Illinois. So migrant clinics in the United States were developed to serve this workforce in the late 1960s, early 70s, and that eventually developed into federally qualified health center systems. And so there's one FQHC system, which is all around the northern half of Illinois. So you can see the dots of where those clinics are located. They do clinical care. They also conduct outreach, research in clinics. They have mobile units and they set up health fairs around the state, and they invite a lot of social service agencies and so on to these health fairs. So as our partner, we're able to go along with them and conduct outreach in the sites where they're doing outreach. We also are able to and do train community health workers. So they have a staff of community health workers, one or two in each of these centers. And they go out into the field. They do screening, clinical screening sometimes, training, education in the field. And so we're able both to go with them, but also to provide them with training that they can then take out into the field. We have a pesticide-related illness prevention training and different grant that we're working with them on. We attend their events, we set up tables, so we do messaging and outreach at their events. And the same with other social service agencies. We're working with a bunch of NGOs, legal aid societies, Illinois Migrant Council, workforce development organizations. The Mexican consulate happens to live for the Midwest, happens to live in Chicago, right down the street from us. So we're very engaged with them because they do a lot of outreach to Mexican workers, Mexican immigrants and migrants with and without legal status. And they also are a backstop for Central American consulates, which are much smaller. So we travel with them. We go to the consulate and do educational stuff there as well. We work with community advocacy groups. We go on site visits with them. We give them training materials. They connect us to farm owners, and sometimes we connect them. We're trying to work with trade and professional organizations as well, which is really critical to connecting with owners and being able to do our research and outreach. And so we look for ways to synergize with them. They have requisite training. For example, they're required to train farm workers on pesticide-related illness according to the EPA's worker protection standard. And so we have the potential to do that for them. And so we're looking for, inroads, entrees, where we could synergistically be welcomed into those workplaces and connect with farm workers. There are also an array of government organizations. We use state and national databases. In Illinois, we actually do the state-based surveillance for occupational illnesses and injuries for the state. And then we've shifted our focus here, or extended our focus on agricultural workers particularly. And so we're able to find workers with health and healthcare needs that get care or service. We're doing public health surveillance using hospital discharge data, poison center calls, and so on. And we have an informatics project to try to nab farm workers out of the electronic medical record in multiple medical systems in the state. We also work with the state workers' compensation agency, although not so fruitful because most farm workers aren't eligible for workers' comp. And then we find employment information. One could find it from the Illinois Department of Employment Securities, which keeps unemployment insurance data, and also the State Department of Labor, which has oversight of housing and various aspects of this realm. We accompany them on field visits, and we're trying to collaborate with them to work on legislative issues regarding oversight as well. So what about training approaches? Again, just to say, these are non-English speaking people. They tend to have limited educational attainment. They have different cultural norms. Actually, a lot of the workers don't speak Spanish as a first language either. They speak indigenous languages from Latin America. So it's particularly challenging to do messaging to them. And what we found within like 2 visits, that all of these messaging documents that have words on them are pretty useless for a lot of these workers. And so we've undertaken a research project to develop, vet, revamp, and roll out pictorial messaging. So heat-related illness is a big problem in agriculture, as we all know. And so we developed a protocol for developing pictorial messaging that could eventually be canonized and used in the field by us and by anyone who wants to use it. So how did we do this? We're at a university. We have a cadre of students in public health who are really interested in this. And so first, we all view a video that shows what the health issues are in heat-related illness. And it's in Spanish, and it's a very kind of how-to guide. Then we list out the adverse health effects that we want to highlight in this. And then the students are sent off to either search for or create a picture that illustrates only one item. And I'll show you this in a second. We want very simple, not busy photographs or drawings. And then we vet those, talk about them, and so on. And we create a messaging document as a draft. We take it into the field. We ask farm workers what they see in the pictures. We adjust the pictures based on feedback, and then we, canonize the document. and disseminate it. So here's an example of one of our products. This is still in progress. And so you can see how simple these pictures are. We go out into the field, we show we stand at a table at a health fair. We get farm workers who come up to the table, and as compensation for their input, we give them merch or swag. We give them toiletries, toiletry bags, a whole variety of stuff. Um, and we ask them what they're looking at in this picture, and this picture, and then this picture, and so on. And we do them one at a time, and then we created this document. And this is a sign of mild dehydration, more severe dehydration, and very severe dehydration. That's how we frame it. And this is the document that students are filling out as they are asking the farm workers in the field what they see in the picture. So here's calambre. This person has leg cramps. There were 8 responses. 7 of them said calambres, and 3 of them added other items to what they saw in the picture. And it seemed that this visual was well understood by the participants. We did the same with these 2. And after they go through all of the photos, we ask them to think about all 6 groups of photos that we looked at. What do you think the photos overall are trying to teach you? What's the main topic? And then we ask them for suggestions to improve the imaging. And so we're not only asking them that, we're also listening to their word choice, because we try to add one word to these photos for people that are literate, or just to clarify. Here's another one where we're talking about, on the top, we're talking about ways to stay hydrated, and on the bottom, we're talking about ways to monitor yourself, to know if you're dehydrated. And so here's an example of someone that had some input, like they looked at this picture and they said, oh, all these workers are sitting in the shade. Why don't you put some in the shade and have a check mark there, and some out of the shade, sitting in the sun, and have, an X through it, something like that. Here's somebody wearing lots of clothes. That's not good. Here's the urine color. So this comes from UC Davis, actually, and somebody said that people are peeing in the field, they're not peeing in a cup, and so their ability to see the color of their urine might not be so great. So that's the first item. Here's another, which is where we just got a small grant to enroll farm workers in WhatsApp. So again, farm workers live in rural, isolated areas. They're often in employer-provided housing, making them difficult to reach. And so we wanted to establish a more consistent communication platform with them so that we could follow them during the growing season and also across international borders. And we did some pilot work, and everybody has a cell phone, and most of the people we talk to communicate with their families on WhatsApp, so they're very familiar with that. And so we conducted an informal survey at outreach events, and we're inviting farm workers to participate in a brief demo about how they typically use the WhatsApp platform and effective methods. So we do that at a health fair. We're going to do 100 of those this afternoon and 50 on Friday at another session. So we just started this. We have 15 people enrolled so far, and we're expecting this to be a hub for farm workers to receive resources and training. We will be able to get them to participate in our programs and our research. The dream is to establish a cohort that we can follow over years. And we also want to communicate with outreach workers for resources and inform the work of farm worker serving organizations as well. And so we can connect them to this WhatsApp group. I think this is the last one I'll tell you about is heat-related illness. So we're doing a user-centered clothing study to prevent heat-related illness in migrant and seasonal farm workers. We know they're at risk, but when you go out into the field and you look at farm workers, you see them wearing clothes like this. It's 90 degrees and they have layers and layers of clothing on, which is a little counterintuitive. Those clothes protect from insects, trauma, abrasions, but there are also cultural norms and beliefs about what one should be wearing in the field. And then finally, a lot of workers don't have a safe place to store their clothing, so they need to wear it all when they're working in the field because there's nowhere else to put it. So our goal is to gather workers and owners and employers and crew leaders' perspectives, their knowledge, attitudes, experiences, behaviors, safety, and protective priorities vis-a-vis their clothing choices. And so we're doing key informant interviews with farm workers and their service supervisors regarding current practices and beliefs. And interestingly, only a handful have been done so far, but workers seem to understand the best choices. They have lots of reasons for not using them. Cost and availability turn out to be very important. So they're being provided a lot of PPE, personal protective equipment from their employers, but the quality of it isn't good. And so they're not able to use that. They need to be able to purchase their own. That's interesting. After we finish the key informant interviews, there will be focus groups with farm workers and supervisors to explore the themes that arose, to show them and identify what they think is ideal workwear, and then to try to build a consensus or to explore whether there is a consensus really about the best choices for clothing. Oh, this is our last one. We put in a grant to OSHA, a Susan Harwood grant to develop training on heat-related illness for ag employers. So this is our pivot to employers and away from farm workers. We want to conduct a needs assessment, draft the training, draft an evaluation plan, develop marketing and recruitment, pilot the training, and then OSHA needs to approve this, and we will start the training and apply for more grant funding. And this would be in the vein of the OSHA 10-hour course for general industry, which is required of certain worker populations. So that's the end of my talk. I invite you to connect with us. Here's our website at the top, and we have a Facebook and Instagram site. We also have an X site, but we haven't posted yet on it. Thank you.
Thank you so much, Linda. That was really informative. Joanne, were you raising your hand? Oh, sorry. you were clapping.
Thank you.
Yes, good.
Okay, thank you.
I see that we have a couple, at least one question in the chat, and I would encourage our attendees to continue to write questions in the chat. But I wanted to ask a question, Linda. One thing that I always think about with, farm workers and migrant workers is the ability to connect with people who might be concerned about getting involved with things because of their immigration status. And I wondered, I don't think I heard you say anything about whether or not you'd had issues with connecting with people or differences with people who may not be legally in the country, or do you find that you aren't able to reach those people, or do you have thoughts about what we can do better to reach people who may have uncertain immigration status? I think this is, some of this is specific to the US, but we have an international audience, and I know that, migrant farm workers are an issue around the world as well. So I'd appreciate your thoughts on that.
Yeah, that's the $6 million question, I think, as we used to say.
Yes.
Well, I don't want to pretend to have a solid answer to that question, but I'll give you my perspective on it. First, H-2A workers are relatively easy because they are in the country legally. And again, as you saw from our work, there are a lot of venues and ways to connect with them. So that's not a problem actually. Going to their housing after hours can be difficult and complicated, both, and dangerous in some ways. They're remote, and that can be problematic. So we never do that, go on a company to those places. So that's H2A. As far as the settled farm workers, um, first of all, we don't ask. We would like to know their status. We want to know who's moving back and forth across the border, and we want to know who's settled and legal and who's settled and, undocumented, as we say. We don't ask that question. I mean, our IRB doesn't permit us to ask the question, of course. But there are questions that you could ask that would let you know what their status is. So H2A, again, for sure, we know, mostly. When you go to migrant clinics, so FQHCs, federally qualified health centers, oh, wow, somebody's mowing the lawn in my yard. I don't know if you can hear that. Sorry.
You're good. We can't hear
Okay.
it.
Oh, okay, it's so loud in here. Okay, so federally qualified health centers see all comers. So they see people that are legal, illegal, undocumented. They don't ask that question either. And so if we're sitting in the waiting rooms or we're going out with them to the sites where they go, then we know we're contacting an array of workers. And then there are other social services for farm workers. There's Migrant Head Start. There's, they're eligible for SNAP. So there are a lot of outreach activities where you can interact with farm workers like that, enroll them in your studies. It's hard to know if they're legal or illegal. We can't really know that. So that's what I would say. Our Department of Employment Securities, there's a lookalike in every state, and they don't easily share, but they know every single employer for the purpose of unemployment insurance. I think quarterly they get a report from every employer that has the name of the company, the business sector, and the number and the names of every employee in that workplace. So if they would share, we could know. Ours doesn't share in Illinois, but maybe in some states they do.
Great. We have a number of questions in the chat.
Okay.
So I think I'm just going to go down the list. Pierre has a question, Labai. Joanne, can you unmute Pierre? And then I think, Pierre, you have to unmute yourself as well.
Pierre, your microphone is active. Can you unmute yourself? Is it possible? It's not working.
Top right corner.
It's not possible. Okay, well, let me ask Pierre's question for him. First, he thanks you very much for his talk. Pierre is the PI of a large agricultural cohort in France. He says he clearly sees the need to identify these types of workers for prevention and education, but less clearly for follow-up of health issues, especially for long-term diseases like cancer. So I wondered, one, if you can sort of respond to that. But then two, he has another question about, if I'm understanding this correctly, Pierre, that the number of agricultural workers and farm workers has increased dramatically in the EU, and wondering if you're seeing similar patterns in the US. Did I get that right, Pierre?
It's not, it's legal migrant workers within the European Union. It's called, maybe the translation is not good, but posted workers. They were here from Spain, for example, with the owner it's from Spain. They bring them into France, and they work in France several weeks, months, and go back to Spain. Yeah. And they are not known by the farm owner because it's not directly the farm workers for this farm. So it's increased a lot in European Union, within Union. In farms, for example, it came from Poland, Romania, in France to work in the fields, but without any follow-up for health issue for these people. They are not known at all on health issue. And it increased a lot in France, and partly in agriculture. So
Yeah,
is that something similar in USA?
it is very similar, almost the same. One thing that's very different between the US and the EU is that people that work in the EU and other countries in the EU can legally, they're authorized to work in other countries in the EU. So if they come from Spain to France, they are authorized to work. That is not the case in the US. So if we're getting people from Mexico and Central America and South America and even Canada, they're not authorized, unless they're specifically authorized to work in the US, they're not authorized. So that's a really big difference when we're looking at these populations, because farm workers' rights in the US are much more limited because of that fact alone. So that's one thing. But in terms of follow-up for healthcare, it's a big it's a big problem. Um, that's why we developed the WhatsApp group. I mean, my outreach team, colleagues are very interested just in outreach and messaging. I'm interested also in long-term connecting them with services, being able to follow them medically over time. This is a way that a health system like Community Health Partnership of Illinois could follow them over time. They have access, they can gain access from Mexico to their electronic health record now in the United States, so they can go online and get that. But we also can retain a connection with them and try to connect them with services. If they go back to Mexico and they stay there, then we have no way to connect them with healthcare. But if they come back to the United States, then we do have some possibility of connecting them. So, work in progress, but it's a big challenge for us.
Wayne Owen has a question. Joanne, can you unmute him?
Okay, you should be able to change your, yeah.
Yeah, got it. Thank you. First of all, thanks for the presentation. I'm an inspector with the Health and Safety Executive in Britain. My question basically is around, I think probably the statistics on serious injuries to migrant workers and non-migrant workers will be more difficult, like we have, more difficult to sort of quantify. But do you have any figures on whether there's a particular discrepancy between fatal injuries to migrant and non-migrant workers? Thank you very much.
Hard for me to say, our numbers are small, and mostly I'm looking at Illinois. So the state of Illinois, we have almost 13 million people in the state, a 6 million person workforce. I showed you the ag numbers. Fatalities, we have about, I think there were, just a few fatalities in agriculture that were documented over the last year, in a year's time. It's very difficult to identify them. Where would you identify them from? Where would we identify them from? We would look for death certificates, so there will be a delay there. We could go to the medical examiner, and that's publicly available data for us. And so we go to the medical examiner and look for the narrative, but there is no calling out of farm workers per se, hired migrant and seasonal agricultural workers. So you would have to, it's a needle in a haystack. You would have to search for that in narrative data and all of these databases. We look at hospital discharge, emergency department, poison center calls, death data, traffic crashes. That's a big one. Actually, that's a big cause of death in agriculture with big agricultural equipment on the road colliding with cars driving on the road. And then ATVs are also a big cause of death here and everywhere. But your question was, how do you find farm workers in that? And the answer is, I have no idea, except to look at them one by one and try to figure it out.
Samuel Furman, I think part of your question has already been addressed, but I think you have your question about other countries would be good.
Yeah, exactly. Thanks, Laura. And thanks for this great presentation. Very impressive what you set up. And yeah, so I think I'm wondering mainly about how this could be scalable to other contexts, countries. You mentioned briefly Europe, which has a different situation, but you also have some experience from countries in Latin America or in Africa, which maybe have similar cohorts. And I'm asking this with a bit of a own interest, because we are currently setting up similar studies in Switzerland, Uganda, and South Africa on coffee and wine farming.
Yeah, well, we want to collaborate with you because we would love to do that. We also have a WHO collaborating center in occupational health and make some contacts like this. So we do have a contact in UAE, Emirates, which has farm workers from Arabic-speaking countries surrounding, and also from Pakistan. So Urdu-speaking people, farm workers, come into UAE. I didn't tell you about our research projects. Actually, I talked about outreach because that's what I was asked to talk about. We're trying to develop a survey tool on worker health and well-being that's specific for farm workers. And so we've gone through a whole process, crafted a tool. We're piloting it in the United States. We have a connection with a Hungarian physician professor in UAE who we're working with to try to roll it out in UAE as well. And we'd really love to connect with other places and extend that. We're in a phase of, we crafted it. We did an interesting, I think, translation approach. We did individual cognitive interviewing. We shrunk it, and now we're doing cognitive interviewing in the field with 60 farm workers. So there's Spanish language and conceptual differences, that we're uncovering. And so we hope, like by spring, to have a survey tool that asks about employment and health and other social factors related to farm working. So we want to connect with you.
This actually, I think, has teed up the next question very nicely from Hannah, who has a question about other occupational hazards. Hannah, did you want to ask your question? I think you have to unmute yourself, Hannah. Otherwise, I guess I can just ask the question. She said that you mentioned peat and pesticides as hazards. Are there other relevant occupational hazards in your opinion? What about stress, financial conflicts, contract situation, and their impact on health? And it sounds like maybe you have some work in that area as well.
Yeah. So our well-being survey, our farm worker health and well-being survey tool has all of those things in it. And so it aligns with the research. It incorporates research on precarious work, that work precarity. So you're talking about employment conditions, and we have lots of questions on those. And stress, which is a little bit complicated. So we've done a literature review on that as well, not published yet, but there's a concept among our farm workers called nervios, nerves, and we've done interviewing around issues that cause nervios with them. So yes, we have questions in our survey around stress and employment conditions. And then, the biggest the biggest cause, the biggest adverse health effect is injury by far. It's really dangerous. People die, have amputations, very severe, they're musculoskeletal injuries, and contact with machinery, as I said, ATVs and, agricultural tractor rollovers is the biggest cause, still the biggest cause of death. It's been the biggest cause of death in agriculture in the US for 40 years and still is not a solved problem for anybody, surprisingly. So I'd say injury is the biggest problem.
I wondered if you had provided contact information for people if they wanted more information, but is this survey that you have something that's available for people that they could ask you for, or are you still sort of developing it, or
Yeah.
if people wanted to collaborate or modify what you've already developed?
Yeah, I don't mind sharing it. It's a work in progress. So I wouldn't share it I wouldn't share it saying, this is definitive or final or anything. And of course, the issue of validity, it'll be different in different contexts and so on. So even if it works well in the state of Illinois, we don't even know if it'll work in Iowa. So, with the caveat that this is a starting point. This is not the final thing, number one. Number two, that you won't scoop us in publishing it. But we would love to share, and we would love to collaborate. I mean, trying to translate this into other languages and validate it among other populations would be fabulous. It would be great to get a comprehensive tool that could be used internationally.
That's great. I'm sure you might get some contacts about
Please.
this.
Please.
And then I think maybe our final question, Richard Remigio. Richard, you want to unmute yourself and ask your question?
Sure. Yes. Thank you, Laura. Thank you, Laura.
Can you put your microphone? It's hard to hear you, Richard, actually. Yeah, I think that. But now you muted yourself.
Wow, it's one thing after the next, I guess. Thanks, Linda. I really enjoyed your talk, and I was particularly interested in the mentioning of a new study that you're deploying related to the incorporation of the farm employers and kind of getting their sort of thoughts and 2 cents. And I'm just kind of wondering. I mean, I guess in putting that together and kind of framing your study, 2 things kind of I was interested in if you could answer is related to just kind of the general sort of willingness, the interests among these employers in actually improving the health or improving the conditions of migrant workers, and also secondly, if there is a lack of motivation, or maybe there's maybe not much thought that was given, if you see if there's an opportunity to create or to bolster interests in creating safer conditions, whether it's economically, like a return on investment, or just pure altruism.
Yeah.
Thanks.
Yeah. Wow, that's a lot. That's a lot of issues that are really important that you brought up. So, I'm thinking that Laura could speak more to motivation than I'm able to. All I could say about interest, willingness, and motivation. I mean, number one, I believe that nobody wants to harm their workforce. Nobody wants farm workers to get hurt. There may be negligence, but I don't think anybody, thinks there's no problem or no issue if a farm worker gets hurt. Certainly not on the part of an employer. And is there a willingness, interest to improve health? So far I've found that to be kind of all over the place. With H-2A workers, they're swooping in, they're employed for 2 months. The owner doesn't even really know them. And they want their crop picked or weeded or whatever it is, And then they're going to leave. So I would say that there's inattention to these kind of issues among that kind of workforce, where they don't know the employer doesn't know them either. They tend to be younger people. Just do the work, and then you'll go home and you'll be healthy, you'll have money, I'll have my crop picked, finished. There's also, I think, what I should call, don't make this a soundbite, but I think there's corporate welfare also in this realm, which is that there are big agribusiness companies. They don't provide any kind of health care to the workforce. If Community Health Partnership of Illinois wants to come in and take care of their workforce, they're happy for it. Please come in, bill the federal government for that, and keep my workers healthy and happy and with good employment conditions. That's very common. So I think you can leverage all of these things. I think you can leverage the FQHC angle of providing healthcare in agribusiness scenarios. So you can get into them. You can offer healthcare, and in the meantime, do training and screening and follow up and blah, blah. So you can use that way. Employers where H2A is coming and going, if you can connect with them for some reason, they're happy to have services supplied to their workers. So then you're on their site, and that tends to be kind of a smaller, kind of more local interaction. You could talk to them about potential for preparing and training or collecting data, whatever it is you want. The other thing that I've spoken about with one of the Aggie professors, who's from Iowa, in fact, is doing a messaging campaign, like a consciousness raising campaign about farm workers, needs. Farm workers are people to imagine being isolated, not having your family around, this kind of stuff. So we've talked about a messaging campaign, maybe to put in churches and rural areas, just as consciousness raising for people that are employing this workforce. So those are my ideas. I'd love to hear other people's ideas.
Yeah, I mean, I think is just to kind of go back to something that actually Linda and I were sort of speaking about before the seminar started, was sort of the very complex nature and interwoven nature of agriculture these days, with more corporations owning the land and or the facilities and animal facilities, and who is actually the employer. That can be very complicated. So I don't know that we are going to solve that on this webinar, but I think that there are a lot of things to consider, and I think it's really interesting to hear about things that Linda and her group are doing. I'm sure that those of you who are working in this space have your own thoughts, and if you would like to talk about them, I think you can maybe raise your hand, and Joanne can unmute you. But I'm also cognizant of the time, and that we allotted an hour for this conversation. So if people want to stay and have this conversation, I think please do so. But I also want to acknowledge that many of you allotted an hour for this, and I appreciate everybody's attention. And I really want to thank Linda for her great presentation and sort of some thought-provoking things for us to consider as we think about farm workers, and how not only to evaluate and study health effects of their exposures, but also to really try to reach out and improve their health. So thank you, Linda.
Thank you. I put my email in the chat. Please contact me if you want anything at all related to this. I would love that.